it's about that time we took a trip to the world of health and wellness and other things related. Now, June is generally a month for men's mental health, and today we have a very special guest who's not a stranger with us anymore. He's a licensed professional for fitness and other things related, and he's going to be taking us through conversations in that regard. Ladies and gentlemen, this morning I have with me Big Harry is what we call him, of course, in-house in the studio. He's a licensed fitness professional with the American Council on Exercise. Good morning, Harry.
Good morning, everyone.
Good to have you in the studio. Welcome.
Yes, another week again.
Yes, so, all right. So, like I mentioned at the start, I said June is generally Men's Mental Health Month. So, what does that even mean generally for laymen out there?
Yeah, mental health is, what I say, the perfect state of mind where you feel very good to almost do anything.
Okay.
But basically, this very state of mind is actually affected by a whole lot of things: your environment, the family you find yourself, a whole lot, even the economy too affects our mental health. But basically, for this month of June, people don't really talk about these things. So this is one of the things we want to talk about relating to mental health that affects men is prostate cancer.
Yes. Okay. All right. If you have questions, feel free to reach out to us via our social media platforms, and we'll give you we'll respond to your messages as the show progresses. Okay. I'm going to reel out the numbers in a few more minutes, but first things first. So let's talk about some of the questions I have for you this morning. And since you mentioned prostate cancer, let's start with the first question here. So it says, an overview of prostate cancer. Just give us an overview of what it is and how it primarily affects men. So because some of us are new to that word, it's prostate cancer. What is it?
All right. So basically, 1 in 7 men is prone to prostate cancer.
Prostate cancer?
Yes.
Okay, I said prostate. Okay.
We have prostate cancer. And as a result of it makes it the second world most prominent cancer that actually happens to men. So the thing is, in science, the prostate gland, which is around our pelvic region, the reproductive region of a man, the gland actually helps to, release semen that helps to nourish a man's sperm.
Okay. And
also helps the man's reproductive organ, basically. Now, this particular region, the prostate region, is also a source of cancer. All right. So as a man ages over time, it actually happens to more of older adults from like 50 years and above.
Okay.
And this kind of cancer doesn't really have symptoms. And most of the time, even if you get to see any symptoms, it is already probably in the late stage. So it is always advisable that as you grow older as a man, you need to go for checkup. So there are medical professionals that actually focuses on things like this. The urologist, this is the actual focus in the medical line. So you can reach out to the medical professionals to help you carry out a different test. But from a fitness point of view, over the years, there are different, just like in the medical line, they try to carry out different research and then come up with probably a medication that will bring about a treatment to a particular ailment. Now, prostate cancer and the fitness line, we've been able to also come up with researches that have proven that fitness can help limit you even having prostate cancer.
I'm glad you mentioned fitness now. So because I want to ask about the age. People that are, what age? From what ages are men prone to this cancer?
From 50 years.
From 50 years. So now that you mentioned fitness.
But if your diet is not really good, from 45, 50 years, you're already prone to it. So it's really advisable from that age group, you go for checkup time to time. It's not a thing that you check it now and then probably realize you don't have, and in the next 2 years, it's something you need to do time to time.
Okay. So when you say exercise can help limit this or, prevent this, what type of exercise are we talking about for 50-year-old men?
Okay, so just a bout of exercise, just a single exercise you carry out within 30 minutes to 45 minutes can help reduce prostate cancer. In short, basically in the fitness science, this is how it works. So research was carried out with about 7 men who already have advanced prostate cancer.
Okay.
Now they already have advanced prostate cancer. So a single bout of exercise was administered to them to carry out for about 30 minutes. Now before the exercise, their blood was taken for test, and immediately after the exercise, their blood was taken for test. Then 30 minutes later, post-exercise,
Yeah.
their blood was also taken for test. So it was realized that what happens is during this 30 minutes of exercise, it actually increased it actually increased the proteins that help to suppress these cancer cells. Because when it is a cancer, it actually multiplies, like it grows very fast.
Okay.
The very moment there is a character change in those cells, it will multiply. So this will now spread from the pelvic region into other parts of the body, which makes it a cancer. So when you carry out 30 minutes of exercise, myokines are released from the skeletal muscles.
Okay.
What these myokines do is they are proteins that help to suppress these cancer cells. So immediately after the research was done within that 30 minutes time frame of exercise, the result of the blood that was taken from this particular 7 persons showed that it was the myokines actually suppressed the cancer cells by 17%. So this is huge. Now imagine where you get to work out as part of your lifestyle
From the get-go.
from the beginning. That means exercise and nutrition has actually proven that with good exercise and nutrition, there's every chances you are not going to actually get the prostate cancer. But then again, on the flip side, it has also showed that over time, people that are actually prone to prostate, the reason why we're talking about this is any human that has male
Organ.
genital or main organ is prone to prostate cancer. All right. Then, for reasons that are not actually known, it is more dominant to the black race than any other racial group or ethnicity. So this is something that actually affects black men as you get older. And the thing is, it doesn't really have symptoms to actually show. But if you have symptoms, some of the symptoms that actually show is your urine. When you're urinating, your urine doesn't go, like, it doesn't go with the right pressure that it's meant to get.
Yeah.
Like the way you're meant to urinate normally, it doesn't flow that way. You begin to lose unnecessary weight that you don't really have any information as to how you are just losing weight. Another thing you are going to use in knowing is, as you progress over time, your bones just begin to get weak. These are all signs of prostate cancer.
Let me pause your thoughts right there. I know that there are some people out there listening right now that want to, ask questions. Now's a good time to do it. And we're taking messages on our WhatsApp platform. We're giving priority to WhatsApp. 0812-806-2337. Once again, 0812-806-2337. You don't have to mention your name if you're seeking anonymity and you want to just ask a question, or if you are maybe going through that challenge, feel free to call us and let's feel free to send us a WhatsApp message rather. Messages go to 0813-806-2337. So it's the Men's Mental Health Month, yeah? And generally we're talking about wellness, all-round wellness for men. But generally I want to quickly talk about practical advice and also benefits of exercising.
So practical advice for anybody that have prostate cancer is carry out follow up with your medical professional. All right, your medical professional will advise you if you're on medication, if you're prone if it has gotten to the level where you have to probably undergo surgery. But even before you get to that level of giving your body the chances to get prostate cancer, you might as well get yourself informed going for the younger ones. All right, get yourself into activities that will help to carry out fast blood circulation all over your body. That is fitness. Carry out fitness on a daily. The research that actually came out has actually proven to us that there's a recommended time frame that you can use in exercising.
How many hours a day is it ideal for exercising?
Okay, so for those that have prostate cancer, you can actually exercise. For moderate exercises, you can carry out moderate exercises of 150 minutes to 300 minutes of moderate exercises. And if you're carrying out vigorous exercises, it can be within 75 to 150 minutes. That is weekly.
75, okay.
To 150
I'm
minutes.
glad you said weekly because
yes, so you can stretch it. Yes, that's the whole point. You can stretch it. You don't have to go to the gym and spend 300 minutes at a go. All right, so you can spend 150 to 300 minutes of moderate exercise.
So if you break it down into one day, what is it?
So you can do 30 minutes to 45 minutes a day, and then you stretch it in a week.
All right. Well, thank you so much, Harry. I wish before I wrap up, though, I'm going to ask you for three tips to give out to our listeners. But really quickly, though, if you're wondering who Harry is, he is a licensed fitness professional with the American Council on Exercise, and it's all about wellness today. So we're just taking a look at prostate cancer.
Yes. General overview on prostate cancer.
General overview. All right. So Harry, final words. 3 tips, for men out there as far as prostate cancer is concerned.
First of all, exercise, carry out fitness, eat right, and then the last but not the least, always talk to someone. All right, that is what we are trying to preach. It is Men's Mental Health Month. We want to use this chance to reach out to those men that are going through any of this type of, underlying health issues. This is something that you need to reach out to. There are professionals out there. You don't have to discuss it with probably someone that you feel will be unable to get you or understand you very well.
You don't have to be shy about it.
Yes, you don't have to be shy about it. You have to discuss it with someone. The thing is, the earlier you even have a knowledge of prostate cancer, the chances for you to actually eliminate it or do away with it, or even at the end manage it. That depends on the stage of the stage of your symptoms, the level at which it has already grown to or gotten to, because this is cancer, and cancer just has to do with cells that are, mutating.
Rapidly growing.
Yes, they are rapidly growing. So this is something that almost 1 out of every 7 men actually attain. So it's something that is serious. It is something that we have to address on time.
All right. Thank you so much, Harry. Always a pleasure having you here. I'm sure